So what is the InternalBrace International Research Study Group? It's a
Well,
long name.
It is a mouthful, Jennifer, but this reflects a collaboration of surgeons internationally that have been working on applications of the internal brace and how it can transform patient care.
It started in Scotland, but it truly is international. It's been formed over 10 years of collaboration around the world.
It has. It wouldn't have gone anywhere without this collaboration. So over 10 years in partnership with Arthrex, surgeons from around the world have been working on refining applications of the internal brace and how it can transform patient care. And this can be applied to any part of the body.
But does it include other disciplines, such as vets, for example?
Well, that's a good question. We have been working recently with the vets, and I think there's a tremendous opportunity to apply this science and technology to the veterinary community and to our beloved pets.
Essentially, this group is producing the evidence-based outcomes that underpin the ongoing success of the internal brace. Is that the main goal?
You've got it in one. I think it's rather meaningless to come up with good ideas if you don't have evidence-based outcomes to support it. And it's this international collaboration that's produced the outcomes when we've applied it specifically for hand surgery or elbow surgery or knee or ankle. We've used specialists within those fields to collaborate and to structure studies that are giving us the meaningful outcomes and the evidence that's showing how it's impacting on patient care.
That is a big goal, but so is transforming patient care, isn't it? That's what's happening. And this partnership with Arthrex is transforming patient care.
It is an amazing partnership. Arthrex have been innovative and enterprising. They have supported us. But the internal study group, much as it's supported with Arthrex because of this partnership, will sit independently because this gives credibility to these outcomes. But essentially, these outcomes will underpin ongoing development. We hope to integrate biotechnology in our understanding of how this can be fine-tuned and improved. But you're right, it's all about patient care. And essentially, in broad terms, we've been able to halve patient recovery time, minimise the risk of re-injury, and make it a much less traumatic experience for our patients. And that's why we've got so many surgeons on board.
So who's actually going to be involved in this research study group? What individuals will be there?
Well, you're right. It's not just me. I've got really good colleagues that have put in some real hard work to improve patient care, and it's applying to their practice. So we'll be doing podcasts, hopefully together, that will allow us to understand more of their experiences. So we'll be talking to Jim McWilliam, foot and ankle surgeon from New York, who's been involved in development of applications, in particular interest in the Achilles tendon. We'll have Bill Ribbons from the UK, who is a leading expert in sports medicine and sports injury, and he'll share his experience. But we'll have people from all over. We're going to be talking to Eric Giza, a professor from California. What a lovely location. And Troy Watson, foot and ankle surgeon from Vegas, of all places. And myself here in Scotland, of course.
That's where it all began. It's an important place.
It's where it started. Like some of these medical ideas, they do, they start in a pub here in Scotland and they just roll out.
I love that medical ideas start in the pub. It's a beautiful thing. So Scottish. But we've got the InternalBrace International Research Study Group, which I am struggling to say. I'm just going to call you the Avengers of orthopedic surgery.
That's
it. You're taking it on, superheroes in the orthopedic world.
We are trying to move on to the next frontier. We're using innovation and technology to change care. And it's been an exciting first 10 years. And we hope the next 10 years is just as dramatic.
Would it make an exciting movie, though?
Only for sad people like myself. I would love to watch an internal brace movie.